We're all coping as best we can with the risks and disruptions that come hand in hand with the threat of the COVID-19 virus. We all have our part to do, and we all have to take this pandemic seriously. But what if the economic cure is worse than the disease? What if our political leaders, with the best stated intentions, are making us less safe in the name of public safety? You see, our long-term ability to ensure the best health possible for every American depends upon our keeping our jobs and a healthy economy. There is, after all, a direct link between economic prosperity and human health. So when I see politicians imposing sweeping quarantines, worker bans, curfews, and other forms of government-mandated social isolation until the threat of COVID-19 ends, I know they are probably not considering the unintended consequences of such a policy. Maybe they're thinking about who will be blamed for not doing enough. You can already see the partisan finger-pointing back and forth. Maybe they're thinking about the next election. They are likely not thinking about or are totally unaware of the incredibly complex division of labor and distributed responsibilities that drive our prosperous modern economy. Even people with the means and the flexibility to work from home and fully isolate still need to find ways to provide food and other essential goods and services for their families. And if they're unlucky despite the best of precautions, what if they need emergency medical services? In other words, like it or not, we are all interdependent on other people still willing, able, and allowed to do their jobs. That means the entire supply chain, a distributed network of farmers and ranchers and pickers and packers, truck drivers, shippers, distribution centers, grocery stores, delivery services, and the tens of thousands of other functions I don't even know about, and untold millions of people with special skills you don't have. Like you, I'm hoping that we get through the COVID-19 pandemic quickly, minimizing suffering and loss of life. I know every healthcare professional in our country is working overtime to achieve that goal. Medical innovators need the freedom to make better testing and treatments available ASAP. Let them do their jobs too. But we need to focus on minimizing economic damage as well, particularly self-inflicted damage caused by sweeping, seat-of-the-pants government decisions that may well be causing more harm than good, by shutting down businesses and destroying jobs that people depend upon to feed their families. I do think it makes sense to isolate yourself as much as possible. Don't take unnecessary risks, and be super cautious to not expose others who are more vulnerable. Read up on the best medical advice available and do everything you can. This is what responsible folks do, and I have great confidence in our shared ability to act responsibly without the government aggressively intruding upon our personal lives and well-being. Be safe out there and stay calm. We got this together, provided that we are free, not just the doctors and the farmers, but all of us doing what we can, each doing our part.